Hello, and thank you so much for joining me today. My name is Melissa Devine, and I'm with the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B, and here today to discuss with you how to choose a Part D prescription plan. Today, the things that we're going to discuss are MAP, who we are, what we do, an understanding of Medicare, and a review of what Medicare Part D is exactly. Let's get started today discussing the Michigan Medicare Assistance Program, also known as MAP. MAP is comprised of unbiased counselors located all across Michigan, offering free health benefit counseling assistance. MAP counselors can help you understand Medicare health plans, compare and enroll in Medicare Advantage coverage, compare or enroll in Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, assist with enrollment into low-income programs, and all around just answer some Medicare questions. So now let's take a look at Medicare. Medicare is insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and enrollment often takes place through Social Security for most. However, for the railroad retirees, it does take place through the Railroad Retirement Board. Now, Medicare does have well-defined benefits and exclusions. It does not typically cover dental, vision, or hearing except under special circumstances. It does not cover long-term custodial care. It does place limits on certain care items, such as physical therapy and durable medical equipment. And it does not offer over-the-counter medication coverage. Medicare does, though, work with private insurance companies to provide coverage for Part D prescription coverage plans, supplemental plans, or the Medigap policies. They fill in the gaps in the original Medicare. And they even work with private insurance companies to provide the Medicare Advantage plans, which combines the parts of original Medicare with Part D coverage and often some dental, vision, and hearing coverage. There are four parts to Medicare: Part A, hospital insurance; Part B, medical insurance, so that's any services that you're going to receive at your doctor's outpatient setting; Part C, Medicare Advantage, which is the HMOs and the PPOs. It's the combination of the Parts A, Part B, and D into one plan. And then there's Part D, the prescription drug coverage, and that is something that you would get with original Medicare, or have the coverage roped into one policy like the Part C plans. Now, when it comes to receiving your Medicare coverage, you do have two options. You can choose to go the original Medicare route. That's Part A and Part B with that original Medicare ID card, the red, white, and blue one. You would then want to purchase a Medicare prescription drug policy. And then you can also add on, if you'd like, a Medigap policy to help pay those out-of-pocket costs in cost sharing with Medicare's Part A and Part B. And then you've also got the second route of getting your Medicare coverage, and that is a Medicare Advantage plan or Part C plan. These plans are HMOs and PPOs, and they typically include Part A, Part B, and Part D together. There are options, though, that do not offer drug plans, but those are typically for individuals who would not need it because they already have some sort of drug coverage. And that drug coverage typically is a creditable coverage. Now, when it comes to original Medicare, you have Part A, hospital insurance, paying for the hospital visits, the skilled nursing facility after a full 3-day admission to the hospital. You've got the access for coverage with home health care and hospice care. And when it comes to Part B, that's the medical insurance. It's going to cover your doctor visits, whether it's PCP or specialist. It's going to cover those outpatient hospital services, clinical lab testing, preventative services, and more. When enrolling into Medicare, it is often automatic for those who are receiving Social Security benefits or even Railroad Retirement Board benefits. An initial enrollment package is typically mailed within 3 months of either the 25th month of an individual's disability benefits or 3 months before the individual turns 65. Now, in cases where automatic enrollment is not taking place, so if for some reason somebody is not receiving Social Security or Railroad Retirement benefits or even Social Security disability, then you're not necessarily going to automatically be enrolled into Medicare. In that instance, you're going to want to enroll with Social Security if you are not a railroad retiree. You can do so by visiting their local office, you can call their local number, and you can even do so online at ssa.gov. If you're retired from the Railroad Retirement Board, you will definitely want to contact your local Railroad Retirement Board to do the enrollments into Medicare. Now, you don't have to be retired to enroll into Medicare. Your initial enrollment period typically lasts 7 months, and it begins 3 months before you turn 65. It includes the month that you turn 65, and then it ends 3 months after you turn 65. There are some other times in which you may enroll. They may or may not include a penalty if you delay enrollment into Medicare, but there are some other times in which you may be able to enroll if you have a special enrollment period. And now that we know the bulk of that info on Medicare, we're going to take a look a little bit closer here at Part D, prescription drug coverage. So, prescription drug coverage, it is a benefit that is also known as Part D. It provides prescription drug coverage to Medicare beneficiaries. This benefit is only available through private insurance companies that contract with Medicare. It is offered either as a standalone plan for those enrolled in original Medicare or as a set of benefits included with a Medicare Advantage plan. When choosing a Part D plan, it's really important to understand what they cover, how much they cost, and how you can find the right plan to enroll in. Medicare Part D covers outpatient prescription drugs. Each Part D plan has its own formulary list, which is a list of drugs that the plan covers. There is law that is requiring all Part D plan formularies to include at least 2 drugs in most categories or classes of drugs, and subsequently all drugs in the following 6 classes: immunosuppressants, which are used to prevent an individual's body from rejecting an organ after transplant; antidepressants, which are used typically to treat depression; antipsychotics, which are used typically to treat schizophrenia and other mental illnesses like bipolar disorder. There's also medications covered under anticonvulsants used to treat epileptic seizures; antiretrovirals, which are used to typically treat HIV and AIDS; and antineoplastics, which are used to prevent the development of tumors. Some drugs are excluded from Medicare coverage by law and cannot be covered by Part D plans, and these include drugs used to treat anorexia, weight loss or weight gain. However, Part D may cover drugs that are used to treat physical wasting caused by AIDS, cancer, or other diseases. The other excluded medications on the Part D list include fertility drugs, drugs that are used for cosmetics purposes or hair growth, and drugs that are only used to treat cough or cold symptoms, drugs that are used to treat erectile dysfunction, and drugs that have not been approved by the FDA. Drugs that have been prescribed for uses other than approved by the FDA, and prescription vitamins and minerals except for prenatal vitamins and fluoride preparations. And that's typically because those are mostly over the counter. Now, when it comes to Part D covering vaccines, absolutely Part D covers vaccines. Part D plans must include all commercially available vaccines on their formulary list, such as the shingles vaccine. They actually are going to cover any of those approved and necessary vaccinations for adults, just like they're covered under Part B, so there's no added cost to the beneficiary. Now, when it does come to the flu vaccine, pneumonia vaccine, hepatitis B, COVID-19, tetanus, and some others, those are covered under Medicare Part B, so you'd want to make sure that the doctor bills accordingly. So how much does Part D cost? Well, there are numbers that are associated with your Part D plan, and those can include monthly premiums, annual deductibles, coinsurance, or amounts or copays that you're going to pay for your covered meds. And a premium, that's the amount that you're going to pay monthly to have your coverage. And in 2023, the base Part D premium, which is just kind of an average, is $32.74. The annual deductible for a Part D plan is going to be the amount that you pay out of pocket before your plan begins to cover your prescription drugs. Now, not all Part D plans have a deductible, but in 2023, the maximum deductible is $505. Now, if you come back here in October and visit us for our What's New to Medicare program, you can find out more information on next year's cost sharing for Part D. And then, as I was mentioning, a coinsurance or a copayment, that is the amount that you're going to pay out of pocket for your covered meds. It is going to be a coinsurance as a percentage. So like a 15% coinsurance versus a $20 copay, whereas a copay is the set amount. Many Part D plans use tiers to price their drugs. So typically drugs that are in lower tiers are going to be less expensive, and drugs in a higher tier are more expensive. Tier 1s are typically referred to as generics. Tier 2s are often referred to as like preferred brand name drugs, or even Tier 3 being the more expensive brand name drugs, and Tier 4s, specialty, etc. Now, these are not official drug tiers. Some generic drugs may be listed at higher tiers depending on the plan and their formulary list, so it's definitely important to look at that specifically based off of what your medication list is when you're reviewing your drug plan options. Now, Medicare does have some Part D coverage restrictions, and coverage restrictions are also known as utilization management tools. And they come with rules that you have to follow before your plan will cover your medication. And there's 3 main types of coverage restrictions. There's prior authorization, step therapy, and quantity limits. Now, prior authorization means that you must get approval from your Part D plan before the plan will pay the cost for the drug. Your provider is often a part of this process and can provide needed documentation to prove that the medication is medically necessary. There's also step therapy, which means that your plan requires you to try a different, less expensive version of your drug before it'll cover the more expensive one. And then quantity limits, restricting the quantity of a drug that you can get per prescription fill, such as 30 pills of X medication per month. Now, there are various phase coverages within Part D, and throughout the year you may notice that you're paying even different amounts for your medications. And that's just because these coverage phases include various things like a deductible phase. That's the point at which, if your plan has a deductible, you start off the year in a deductible phase. During this time, you're going to pay out of pocket for the entire cost of your meds until you reach whatever that deductible amount is. And again, for 2023, that can be up to $505. There's also the initial coverage period, and that's the point that you'll be at after you've met your deductible. So if you have a deductible and you've met it, you're going to move on to the initial coverage period. During this time, you and your plan are going to share the cost of your prescription drugs, and you are going to pay the plan's copays or coinsurance amounts at the pharmacy. Then you enter into the coverage gap, which is after your total drug costs reach a certain amount for the plan, you enter into the coverage gap, formerly known as the donut hole. This amount combines your copays, your coinsurance amounts, with the amount that your plan has paid for the meds. And it's important to note that low pharmacy copays doesn't necessarily mean that you're not going to reach the coverage gap. When you enter the coverage gap, though, you will be responsible for 25% of the total cost of your meds. And then once you have exited the coverage gap, meaning you've met your true out-of-pocket cost for the year, you're going to move then into the catastrophic coverage phase. And that is where they take into account the amount of your deductible, your copays, your coinsurances, the amount that you've paid during your initial coverage period, almost the full cost of the brand name drugs, including any manufacturer discounts that you received during your coverage gap. Any amount that was paid by your plan does not count towards your catastrophic coverage. But once you've met it, you're only responsible for 5% of the cost for your meds. Your plan is going to keep track of how much money you've spent out of pocket for those prescription covered drugs during the coverage periods, and the information will be printed to you on your monthly statements, also known as an explanation of benefits. So if you're ever in question, you absolutely can look at your EOBs from your Part D provider to view those phases and where you're at currently. So there are many things to consider before choosing a Part D plan, and depending on your needs, your financial situation, your preferences, some of the following questions and guidelines may be really important to you, or more important to you than others. So I would just take a minute and think, does this plan cover my medications? If I take a lot of prescription drugs, choosing a plan means it has to have all of them on its formulary list. So, what costs are going to be associated with that? Am I going to have to go through a step therapy if the med I take isn't on their formulary list? what am I going to have to worry about in terms of a pharmacy? Am I going to need to switch my pharmacy up? What's this plan's rating? Because a plan rating is going to include how many other members in that plan actually are taking these surveys and saying these people are great at X, Y, or Z. So some of those things may be more important than others. And the X, Y, and Z can include customer service, coverage, and more. So when we look at enrolling into Part D, while it's technically considered optional, if you don't sign up for Part D, though, when you're first supposed to, and you don't have creditable coverage to delay it, then you're going to end up with a late enrollment penalty. However, if you have what's considered creditable coverage, then you can delay your enrollment into Part D without incurring a late enrollment penalty. And those can be employer coverage plans, retiree insurance policies through previous employers, military benefits, federal health benefits. So you'll really want to take a minute and kind of look at your coverage and even reach out to the plan themselves and ask them if they haven't sent you already proof of creditable coverage for that. So that once you have that on hand, when you do choose to enroll into a Medicare Part D policy after you do retire, then you won't have to worry about, late enrollment penalties and messing around with too much, because you can submit, proof and documentation. So when you join a Medicare prescription drug plan, though, when you first become eligible for Medicare, you want to make sure you do so during your initial enrollment period. So that's 3 months before you turn 65, the month you turn 65, and for up to 3 months after you turn 65. You can also do changes, make enrollment changes in the annual fall open enrollment period, which is often referred to as OEP and AEP. That period is October 15th through December 7th each year. Any changes that you make during that time, coverage will begin then January 1st the following year. There are often times that individuals have special enrollment periods. So if you have an involuntary loss of creditable coverage, if you move, if you end up having a change in your coverage eligibilities, i.e. low income or not, you can make plan changes at that time as well. And to do so, you can reach out to the plan directly by calling them. You can visit Medicare.gov's website, or you can even call MAP for assistance, and we can help you walk through stuff and even help with an enrollment. Now, as we were just talking, I had mentioned special enrollment periods. That is a period of time outside of the normal enrollment period when someone can do an enrollment change or just enroll in general into health coverage. So if you're covered by creditable drug coverage and you choose to delay enrollment into Medicare without penalty, right, because you have creditable coverage, then you're going to want to make changes to your enrollments as soon as you know that you're retiring, right? Because you're going to get an SEP that's good for up to 2 months after losing your job-based insurance, that credible drug coverage. And you're going to use your Part D SEP to enroll into a Part D plan of your choice without the late enrollment penalty. Now, to use the Part D SEP, again, you have to have credible coverage through any of the following: the Veterans Affairs, VA benefits, TRICARE for Life, federal employee health benefits, some job-based retiree plans, and even COBRA drug policies. So if you're not certain, and you would like to inquire more, I would reach out to your benefits administrator through your employer or through the plan directly to, again, make sure that you're getting that proof of creditable coverage. Now, if you do not have creditable coverage and you do not enroll into your Part D plan, then when you're supposed to, you will end up paying a late enrollment penalty. This is going to be accounted for each month that you delayed your enrollment into Medicare Part D coverage. And the penalty is added onto your monthly premium, and it will continue with you for the entire time that you have Part D coverage unless you qualify for the Extra Help program or prove that you received inadequate information about whether your plan was considered creditable or not. So as we look into this late enrollment penalty, again, it is calculated by taking 1% of the Part D base beneficiary premium. That's $32.74 this year. And you're going to take that and multiply it by however many months you were without a Part D plan and not had credible coverage. And that's going to be how you calculate your amount in percentage. Now, SSA will ultimately send you what the final number is, so you'll get that information ahead of time. But if we were to just say, 7 months of no Part D coverage in 2023, you'd be looking at paying an extra $2.29 a month, because it's 33 cents times 7 months, $2.29. So it's not necessarily hugely drastic for most individuals, but it can be. And even if you choose to get into a plan that has a lower monthly premium, that's not going to change your penalty amount. Your penalty amount is what it's going to be based off of the amount of time you didn't have the coverage, and based off that beneficiary premium. So with the base beneficiary premium, it does change each year. So it can definitely go up, and it can, as we saw this year, go down. It went down from last year. So all things are possible. Now, if you have a higher income, you're going to expect to pay more for your Medicare drug coverage. If you're above $97,000 for a single individual, or for those that are married filing joint, above $194,000, and for those that were filing married and or separate with their tax return, $97,000 or less. You can see we have a sliding scale here based on the number in income. So if you have questions about this, reach out to us, let us know. We're happy to look into where you would land on this chart to give you a little bit more info as to what you could expect in cost. So if your income and assets are below a certain level, you may have access to some resources to help you with your prescription costs, as well as just your costs for Medicare in general. So there's a program called the Extra Help Program, and that helps you with the cost of your prescription drug coverage. So it's going to help cover your monthly premium, depending on the level of subsidy that you qualify for. It's going to help cover the cost of your copays, coinsurances. It also is going to, help take care of that deductible portion. So then that way, if you had a plan that had a deductible, you wouldn't have to worry about that you wouldn't have to worry necessarily about that full amount, again, depending on the level of subsidy that you qualify for. Now, for qualifications for full extra help, your income would need to be at $1,660 a month gross as a single individual, or $2,239 as a couple, with assets at $10,590 or less for a single individual, or $16,630 or less for a couple. There's also assistance for Medicare coverage and costs in general through like Medicaid programs. There's even some assistance with drug manufacturer or pharmaceutical assistance programs, and even places like GoodRx. You can compare cash prices. They offer coupons if you're going to pay cash. And so if that's easier than, having to switch to a different plan based off of a formulary list or coverage restrictions, etc., then it's definitely something to look into. Now let's take a quick minute here to talk about Medicare fraud and abuse. Now, Medicare fraud is the most common scheme affecting seniors. Oftentimes we see it as individuals getting billed for services they never received, or equipment that they never received or that they returned. It's often sometimes even someone using someone else's Medicare information just to get coverage, and or even a company that's using false information to mislead you into joining a Medicare plan. But as of recent, we've seen third-party healthcare services trying to conduct what's called Welcome to Medicare and yearly wellness visits, and they claim that they're going to file a claim with Medicare on your behalf, and it may not necessarily be Medicare fraud, but it's definitely abuse of the Medicare system, because these wellness visits were intended for you and your primary healthcare provider, not for an outside individual, especially if they're going to tell you that it's not something your doctor is supposed to provide, because it is actually something for your doctor. So if something like this pops up for you, definitely report it to your SMP, which happens to be MAP. If you give us a call at our 800 number, we can absolutely help you report fraud and abuse and scams. One of the other scams that we've been seeing is with COVID-19 tests. They're tests that are, in the mail that people did not order and they're getting billed for it. So if this happens, take a picture of your shipping label and any other information that's included in the package. Contact us at MAP through the email address we have listed here on our slide. And then take pictures of your Medicare summary notices and send those to MAP as well so that we can get all that information to the Office of Inspector General and to our state office for MAP Inc. And make sure everybody's aware of the fraud and scams that are happening in the area. There's also some that are making phone calls to Medicare individuals that are issuing quote unquote plastic Medicare cards. We don't know that this is actually something that Medicare is trying to do. They have not released that information, so I wouldn't give out your personal information if you were to receive the call. And again, if you did give your information out, give us a call. We can try to help. We can reach out to Medicare if we think that there's a number that's been stolen, etc. There's also things in the area like the Area Agency on Aging 1B. We are out here helping seniors and their families. The general history of area agencies on aging around the nation is that they were created by an act of Congress in 1974 as a national network connecting seniors, persons with disabilities, and family caregivers with local services to improve their quality of life. There's over 600 in the U.S. alone. And we use elder care locator websites, or you can reach out to our number here to find the AAA that is serving the area that you or your loved one lives in. Now, our Area Agency on Aging 1B, it is a nonprofit with a wide variety of programs and services and supports to older adults and their families in our 6-county region that serves Livingston County, Macomb County, Monroe County, Oakland, St. Clair, and Washtenaw counties. There are 2 separate area agencies on aging serving Southeast Michigan that are designated for Wayne County, with Wayne County being as large as it is. So that one is split up in between 2. But you can contact us at our 800 number, 800-852-7795, or reach out to us at aaa1b.org through our website. Now there's programs again that I mentioned that can assist. We offer free phone helpline for seniors and their families. We can help guide seniors and family members to understanding home and community-based services, and we're typically the first place to call when you or your loved one needs assistance. So MAP is here. We're here to help you. If you want to talk to a counselor about your specific situation, just give us a call. We're currently counseling over phone, through Zoom, and in person where available. And our services are unbiased, they're completely confidential, and there really is no question that's too trivial. We often deal with very complicated questions as well, so we're here to help. And if you'd like more information on Medicare outside of MAP, you have access to things like the Medicare New Book, which gets sent to you specifically in the fall. There's also Medicare.gov, which is Medicare's website, all available online all year. And then even you can reach out to Medicare by calling them at 1-800-MEDICARE. But for your most up-to-date local information, you're going to want to contact MAP at 800-803-7174. We are your best local source here. There's no question that's too small or too difficult. We are going to give you all of the resources possible and answer all those questions for you concerning your Medicare. And we've saved over $2 million for beneficiaries in the area alone. So give us a call and we'll be happy to help. This is just a brief funding statement from the SHIP and SMP, who are our funders for the MAP program and help make these things possible. My name again is Melissa Devine. If you have any questions, please feel free to reach out to me at mdevine@aaa1b.org. That's mdevine@aaa, the number 1, B as in boy.org. Thank you so much for your time today. You have a wonderful day.